Now, President Cyril Ramaphosa says the decision to move the country to level 1 lockdown was based on scientific advice. But some experts are not convinced about this. And Dr. Joe Barnes from Stellenbosch University is actually one of them. Doc, thank you for your time and good morning. Why are you not convinced by the scientific evidence with which the President says informed his decision to move the country to level 1?
Good morning to you and good morning to the viewers. It is very difficult for us who work in this field, I'm an epidemiologist, to judge what the President says because of the policy of making no information on which they actually base their decisions public to us. So we know that they have a ministerial advisory committee and we know that advice goes to the presidency, but how those decisions are made and what other factors are kept into the mix or brought into the mix, we have no idea.
So are you saying there isn't much consultation between government, the presidency and experts as yourself? I mean, as an epidemiologist, I would think that your opinion, your view, your expert advice would be key to such a decision?
There are epidemiologists in the advisory committee, but we do not know how much of the their reports to the president are also not made public. So how much of the decision in the mix is actually political or social, and how much of it is based on scientific evidence, nobody can judge. So I'm very concerned about that whole process because we have a large number of people who are vaccine hesitant, and much of that hesitancy hinges on the fact that they basically don't trust. So if the real decisions are made behind the scenes in secrecy, that feeds into that distrust. So that's a very unfortunate situation.
What also concerns you about, this move? Because we've spoken to a number of other medical experts saying that it's critical for South Africans not to be COVID fatigued and let their guard down and relax because they're seeing those numbers going down, but also because we're moved to level 1. But for you as an expert, as a medical expert, what are your concerns about what you think could possibly happen if we don't have control of this level 1 move?
I'm concerned that there are two things that are now falling on top of one another, and that is the vastly opened up numbers of people, both indoors and outdoors, that can now mingle or come within relative close contact. And we know that across the country, social distancing is not properly observed in many places, on top of an election. And I'm just so concerned that we may manufacture a really big fourth wave. Look, a fourth wave is going to come, but what is in dispute or what is in our hands is the height of it and the numbers involved and the timing. So if the South African population, in inverted commas, behaves well, then hopefully the fourth wave will be small. But now everything is muddied by the fact that there is an enforced very large super spreader, possible super spreader event called the election. And that is my concern.
Yeah, and I suppose that also feeds into the concern around whether this decision to move was politically motivated, because we know that there's a high and intense political campaigning right now from various political parties, and even medical experts warning that these campaigns and compelled trains might also cause super spreaders. What would then be your caution to political party leaders at this time leading up to the 1st of November, which is Election Day?
It is a very difficult situation for them because if they do everything online, which is the safest option, obviously, then they miss out on a large number of our less fortunate population that doesn't have the money to go online. So, and one political party is actually openly defying any of the social distancing and masking, etc., it is tragic. But it is a difficult situation for that. It is a political conundrum that when things go wrong, the consequences will be felt at the health services. They will pay the price, and the sick population.
All right, we'll leave it then. Thank you so much for speaking to us. Stellenbosch University epidemiologist, Dr. Joe Barnes.